5 months, my dog Emil had an ear problem that needed treatment 3 times a day. He hated that, and we needed 3 adults, a muzzle and a head halter to get the medicine into his ear canal as he was fighting for his life. This was when I started medical training, as the process was too time-consuming, too stressful, and it was difficult to find helpers for a dog with such aggressive reactions to pain. Now Emil is 6 years old and learned to tolerate medical treatment. My dog Emil had a surgery 4 days ago. He had a deep cut in his paw and now has several stitches. I need to redress his wounds daily. He shouldn't lick his wound. Yesterday it was his first day without painkillers. Although I'm very cautious during changing the bandage, I always give him treats and praise. He showed me his teeth last night during taking off the bandage. Here I show the entire process of changing the bandage the next morning. The incident the day before was not filmed, as no one knew it in advance that Emil would show his teeth. Of course I could squeeze his injured paw to show you his reaction to pain. This would be unethical for a YouTube clip, and it would be a betrayal of my dog's trust in me. This is why you don't see aggressive displays throughout the clip, but what you can see are many signs of stress. If your dog growls at you or shows any other aggressive display, please do not understand this as a personal insult or as a sign of distrust. This is not what it is. Most likely, you just hurt your dog. Understand your dog's reaction to the pain as that what it is. A message. Your dog is unable to say, "Ouch! That did hurt! Please be more careful in the future." Your dog's way to give you that message is either aggressive displays or flight. Right when you gather your things for changing the bandages, your dog will know what is going to happen next. He learned that last time. He is frightened and wants to avoid the unpleasant situation. Many dogs tolerate necessary medical actions quite well in the beginning and then become more sensitive towards it every day. This is also the case for Emil. The more you hold your dog down or force her, the worse becomes her fear of the next medical treatment. The fear can become really big just within a few days. The way out of this vicious circle is to proceed step by step, avoid overwhelming situations, avoid stress, and react to your dog's messages. Hand over the power over the situation to your dog. It is frightening to any creature to lack control over what is happening to one while in pain. Give him control over when and how fast things happen to him. When your dog understands that you wait for him to be ready, a big part of the fear dissolves on its own. Preparations. Prepare all things you will need: food, bandage, a pair of scissors, medicine and a clicker. Your dog knows the clicker from many happy training sessions before. A painful medical treatment is not a suitable first encounter with a clicker. Choose a quiet place that your dog likes, for example your sofa. In no case corner your dog for a treatment. This can increase fear and aggression. Do not choose your dog's bed. Your dog's bed should be a safe haven to your dog. Put a leash on your dog. Chasing your dog through your whole flat does not provoke calm behavior during a medical treatment. Consider to use a muzzle, especially when your dog has ever injured a person or a dog, or there are any other signs of poor bite inhibition. Identify the problem behavior. For Emil, this is aggressive behavior like showing his teeth or growling. Identify what usually comes before the problem behavior. We are looking for some behavior that indicates that the dog will next do, for example, the aggressive behavior. For example, this is freezing for Emil. During the exercises, click the absence of the indicator. When you get the indicator, interrupt the training session, go a step back in the training plan, and then continue. Start a medical training session just like any other training session with a behavior the dog already knows very well or the dog does anyway. Prepare all things you need and then bring your dog. It is obvious that Emil tries to avoid the situation right from the start. Mentally, he withdraws from the situation. Emil tends to freeze in such situations, to turn his head away from me and not to move at all. This is why I click and treat any movement he makes. Every click is followed by food. Do not give any cues to your dog in such a situation. We do not want to test obedience, we want to change emotions. Training steps. First, do not touch your dog. Click your dog for being present in the situation. In other words, click the absence of undesired behavior. No growling, click. No bare teeth, click. No attempt to escape, click. Click when your dog makes eye contact with you. Second, your dog tells you when to proceed to the next step. When your dog swallows the food and makes immediate eye contact with you, he is ready for the next step. Your dog learns that he is in control of the situation and that there is a communication system. He can make you repeat the same step and he can make you go on by giving you immediate eye contact. Here is a slow motion of the last trial. Emil swallows and gives me a look. Now he is ready for the next step. Be patient with your dog. Don't forget, your dog might perceive this situation similar to being in a dungeon at first. Give him the time he needs. For even more sensitive dogs, start touching a different body part than the injured one. For allowing to be touched, the sequence is touch, click, treat. When you get eye contact immediately after swallowing the treat, get half an inch closer to the injured body part. Get closer very slowly and only after your dog's permission by immediate eye contact. Third, when the dog is fine with touching, the actual medical treatment can start. Click and treat every manipulation. Click anything that might be painful. Never force your dog. He can withdraw the body part whenever he wants. You might find it helpful to have a helper to click and treat. Or you might want to switch to a marker word for that part to have both hands for the change of bandage. In case your dog attempts to lick the wound, interrupt the behavior. Simply shove her head away with your hand, gently. Your dog is supposed to learn to communicate his stress to you, but other than with aggressive displays of love. What to reinforce? Reinforce your dog for being just present in the situation. When medical treatment had been very painful experience for your dog in the past, it might take quite a time to even bring the dog to the place where you prepared the medicine and bandages. Go at your dog's pace. Reinforce any sign of stress in your dog, like nose licking, yawning or ground sniffing. Your dog gains a feeling of safety as he learns the communication system. As long as he shows stress signals instead of immediate eye contact, you will not go on to the next step. When your dog showed you that he is ready for the medical treatment, you click any manipulation. Never force the dog or grab a body part. Your dog can stop the aversive situation at any time. We want your dog to participate voluntarily. We want his cooperation. What to do when something goes wrong? Whenever your dog withdraws a body part, shows any sign of stress or tendency to flee, interrupt the situation and start again with the very first step. Reinforce your dog for being present in the situation. For very sensitive dogs, and when the medical treatment allows the delay, it might be a good idea to do a relaxation protocol before restarting the medical situation. Never shout at your dog or punish her during the medical treatment. That would increase her fear, and we want the fear to decrease. This could also provoke defense in your dog. The aggression could be directed at you right in the situation, or later in your dog's life at a vet or the vet's assistant. Your vet will appreciate you preparing your dog in a force-free manner for medical treatment. Medical training, just like any training, is work and takes time before it makes lives easier for the human and the animal. A medically trained animal is prepared for situations like changing bandages. And when your dog gets injured, the medical treatment takes less time, can be done without any helpers, and causes less stress in human and animal.